My name is Diana Tzeng. I am a stroke neurologist here at Thomas Jefferson University in Center City. There are 800,000 people who suffer a stroke every year here in the United States. One of the most important messages we can get out to people is that if you are concerned that you are having a stroke, that you should not wait and should get to the emergency room as soon as possible. What are some of the symptoms to look out for? Sudden onset of a facial droop or slurred speech, difficulty using your arm or your hand, sudden weakness in your arm or your leg, walking problems, balance issues, or sudden vision issues can all be signs and symptoms of an acute stroke. So we urge people to go to their closest emergency room as soon as possible. For patients who have diabetes, the scenario can be even more complicated because very high or very low blood sugars can sometimes cause similar symptoms to acute stroke symptoms. If symptoms persist, we really recommend that patients go to their closest emergency room as soon as possible rather than waiting any period of time. This is because there are some interventions and some medications that we can do for stroke patients that are time sensitive. So in the last 30 years or so, acute stroke care has come a long way in terms of clot-busting medications and also procedures that can be offered to some stroke patients that can really help their recovery down the road. Something else that diabetic patients can focus on is trying to keep their blood sugars as well regulated as possible. Trying to avoid any major spikes in blood sugar or any dips in blood sugar can help prevent signs and symptoms that might mimic a stroke and therefore cause further confusion when it comes to the diagnosis. In terms of prevention, it's very important that diabetic patients try to keep a steady blood sugar rather than spikes and dips, and also keeping their hemoglobin A1C, which is a reflection of their average blood sugar over the last 3 months, to a low number is also very, very important. A healthy, well-balanced diet, as well as routine exercise, can not only help keep diabetes in check, but also help with stroke prevention. So those lifestyle modifications are also very important. Managing the diabetic patient who comes in with stroke symptoms can be very tricky for some providers. It's important to rule out either very high or very low blood sugar as the cause of a patient's symptoms. But after that, if a provider is highly suspicious of a stroke, then treatment of the diabetic patient is largely the same as a non-diabetic patient. They are candidates for clot-busting medications like IV TPA or TNK, and they should certainly be considered for mechanical thrombectomy if they are an appropriate candidate. Studies have shown that tight regulation of blood sugars while these patients are in the hospital with an acute stroke is very beneficial. However, not overly aggressive blood sugar management, as that can sometimes be detrimental. Again, overall, the diabetic patient can represent a particularly challenging group of patients to manage when it comes to acute ischemic stroke. But with attention to detail and also patient-centered care, it certainly can be done well. Preventing a second stroke can be a very complicated and challenging task, especially in the primary care realm. And there are lots of different pieces to that puzzle. So controlling blood sugar for the diabetic patient is of the utmost importance. And there are now a lot of new medications that can be utilized to achieve a steady hemoglobin A1C. In addition, blood pressure control is incredibly important. And any class of medications utilized for blood pressure control can be very helpful in preventing another stroke in these patients. But ACE inhibitors and angiotensin receptor blockers, or ARBs, have been particularly studied in the stroke population and are effective. So utilizing medications from those two classes are particularly advised. And then there's a lot of counseling that needs to be done in terms of lifestyle modifications, choosing the right foods to eat, maintaining a healthy diet. Sometimes our patients don't have access to that information, and that's very important to be counseled on. And then trying to get in some daily exercise and physical activity, especially things that get your heart pumping, cardio, extremely important for preventing that next stroke, whether in diabetic patients or non-diabetic patients. Cholesterol control is also very important, and we are utilizing a lot of what we call statin medications these days, medicines like Lipitor or Zocor, because they have additional benefits for being anti-inflammatory medications, which can also help to prevent stroke, in addition to their cholesterol lowering effects.